watch this, it's like get grip. Nothing to trip on, it's on and on, got work, it's hope you're listening like, keep an attitude positive, show gratitude, back rock, it's a lot of life to live, keep up, first of all.
Cheap and within easy reach, drugs are everywhere, giving a buzz, giving a high, or easing the evening along. But drugs have a dangerous flip side. Nearly 1,500 people a year die from taking illegal drugs. Another 5,500 die each year from drinking too much alcohol. Drugs and alcohol are responsible for many of the cases at the Royal Liverpool Hospital. Its accident and emergency department treat more than 8,000 patients every year. Around 100 A&E staff deal with nearly 7,000 patients a month. Every week, at least 500 of these patients' injuries or problems are related to drink or drugs.
Well, there you go. Royal emergency.
Dr. Rob Hunter, a senior member of the A&E team, takes an emergency call.
Okay, thanks. Okay, cheers, bye. 1 minute.
Working with him tonight is Dr. Dave Macklin.
Do you want a hand, Rob?
Yeah.
No problem.
Grant's in the resuscitation room. He's overdosed on heroin.
Do you know what else he may have taken?
Hello there.
You're not breathing very much and you've got a low oxygenation. We need to give you some oxygen. You'd stopped breathing earlier on. He's taken some heroin and essentially he's come into us because he stopped breathing. The ambulance crew were sort of bagging him with a bag to breathe for him on the way in. Want to have a look at your eyes a minute? If you look at his chest, it's not really moving very much, and the monitor was showing that he wasn't getting much oxygen across his lungs into the bloodstream, so we've put him onto an oxygen mask to give him high concentration oxygen that's picked up, but he's still not breathing very much. We're giving him an injection of the antidote just to try and stimulate his breathing a bit more. The main problem is we don't really know what else he's taken. We can tell by looking at his eyes that he's definitely had heroin, and the fact that he's so drowsy and he's stopped breathing is exactly what we'd expect from heroin, but he may have taken other drugs.
So your temperature's...
In the next ward, Dr. Kate Clark is dealing with 16-year-old John Paul.
I think that the reason that...
He's been feeling unwell and has come into hospital with his girlfriend.
Have you noticed any problems? Have you had a temperature, any sweats or flushes? Okay.
He's had a high temperature, not last night, the night before he had a high temperature.
Yeah. Okay.
That's when we started worrying.
The nurse said on the assessment sheet that you took some tablets about a week ago. What tablets were they that you took? Right. And how many of those did you take?
2.
And have you ever taken those before?
No.
That was the first time, a week ago.
I don't like the feelings.
You don't like the feelings, okay. Have you felt sort of paranoid or anything like that?
Yeah.
In what way? What kind of things have you been thinking?
Like, can't stop. Just like, can't relax. Just nerves all the time. Just can't explain it.
So try and describe how your head's feeling when you get these episodes.
All stiff.
Right, do you feel like you're going to pass out or anything like that?
I have done before.
And have you taken anything else since then?
Cannabis. And I stopped it now.
Okay.
I feel alright when I have that. I go funny again. And I stopped it, so...
Have you been smoking cannabis for a long time, or was that
Long time.
over how long?
Since I was about 9, 8.
Okay, and how many times a week would you smoke that?
When I get money.
So as often as you can.
Yeah.
Paranoia is something that we often do see, particularly associated with chronic cannabis use, and that's where you feel that people are actually out to get you and, you know, specifically targeting you and treating you badly. He hasn't actually experienced that. He's more relating, just sort of describing anxiety or panic feelings, which again can be related to the cannabis or secondary to the ecstasy as well.
Dr. Dave is called away from Grant to treat Ben, a heroin user who's come into the unit with a swollen left arm.
I'm an intravenous drug user.
Yeah.
And about 4 days ago, I injected into the right side of me right leg, my groin area.
Okay.
But
Yes.
the next day, I couldn't properly move it. I can't move it at all now. It's just aching and aching. And as you see, look at the size of that one to that one.
Okay.
So,
Have you had anything like this before?
I've had an abscess in the groin before. Yeah.
In your groin? You had blood clots before?
No, never.
Right, let's have a look at this arm then. Can you straighten it?
No.
Okay, I'm going to straighten it. Okay, so
I can't straighten it.
Well, let me take the weight for it.
I can't straighten it.
Well, I need to have a feel of it, so just relax for me.
Dr. Hunter to Majors, please.
Grant is still not breathing properly and his oxygen levels are dropping. He's been given a type of heroin antidote to reverse these effects. The consequences can be quite extreme.
He's starting to go through cold turkey now. He's starting to shiver and it's quite unpleasant, cold turkey. Acute withdrawal, if you were to give this intravenously, and a very heavy addict, sometimes can be a bit cruel. They start shivering, they get muscle aches and pains in their legs and their back, they get stomach cramps, vomiting, the bowels open, they have loose faeces, start sweating, and it's quite unpleasant.
Okay. So we let you get dressed and let you go.
For John Paul, there's no immediate danger, and Dr. Kate gives the all clear.
Can I have a look at your groin, please?
Yeah.
Is this where you always inject?
That's infected, isn't it?
It's a bit manky, innit? Stuff coming out of it. You're going to need to come into hospital over this.
What do you mean?
You're going to need to come in and stay in.
Stay in? So
Yeah.
I'm going to be staying in tonight?
At least tonight, yeah. This is quite a serious infection. I'm fairly certain that it's as a result of having injected into your groin. As you say,
And it's
the infection can travel anywhere.
It's spread through my bloodstream and it's come out.
What we'll
there.
need to do is get your elbow x-rayed to make sure that there's no infection in the bone.
What if there is?
Well, it's just...
Is there any chance I could lose that?
It is very serious, I'll be honest with you. This is quite a bad infection. And you're going to need to have antibiotics into a vein, at least for 48 hours. Okay?
There's no way I can stay here unless I get my medication.
Right. First thing is, we don't bargain over giving you drugs. Just hear me out for a second, okay? We have strict rules about... No, listen. We have strict rules about how much methadone you're allowed until such time...
To feed his habit, Ben buys his drug on the street and also relies on his GP prescribing him the heroin substitute methadone. He also is dependent on the sedative diazepam.
Nothing will happen to you if you don't take your diazepam.
I don't agree with you.
Well, I'm not going to debate it with you. I'm not going to debate it with you. What I'll say to you is, you will get a certain amount of methadone until your drugs can be confirmed. It's your decision. This needs help.
Methadone is highly toxic and users are given carefully controlled amounts. Too high a dose can kill. Ben says he takes 45 milligrams a day, but until this is confirmed with his GP, Dr. Dave can only give him 10.
10 milligrams? Yeah. Alright. I'm going to sign myself up then.
It is your decision about that. I mean, obviously.
And then I'm going to come back. I'm going to show myself and come back. Okay?
Well, what I'll say is...
I'm going to go and get my own prescription and come back because you're having none of it.
No.
Do you know what I mean?
Ben fears he may suffer withdrawal symptoms without his normal dosage and leaves without treatment.
I'll be back.
his addiction is the most important thing in his life. He, and the majority of heroin addicts, that is the one and only thing that matters to them. They're prepared to risk their life and everything else in their life for the sake of feeding their addiction.
Grant shows no sign of improvement. He's still experiencing cold turkey.
And you've had an injection just to try and reverse the effects.
The reason it's called cold turkey is because they get goose flesh, just like turkey skin or chicken skin. The skin becomes very clammy, sweaty, and very cold to touch, cool to touch, and it just feels like touching a dead turkey. Addicts will refer to it as rattling when they get this thing.
Dr. Dave is concerned that Ben's not yet returned for treatment.
I was hoping that he'd come back sometime during the course of the night. He's put himself at serious risk of A, endangering that limb, and also endangering his life, because that infection is more than likely going to spread into his bloodstream and causing problems with his heart and lungs, and even possibly if he was to get the infection in his brain, and it could kill him.
You called Grant?
Treating people with drink or drug-related illnesses can be costly. A bed for the night costs £200 and an ambulance ride is £100. And that's not counting the medical costs. Grant was put on the ward for observation overnight, but early the next morning he left hospital of his own accord. Every year, £36.5 billion is spent on alcohol in the UK. It's estimated the NHS spends £3 billion a year treating people with alcohol-related problems. 3/4 of people attending the Royal's A&E department after midnight are drunk.
Alcohol presents itself in sort of one of maybe 3 or 4 different ways. The most common one that we see is Friday, Saturday night violence, people being assaulted, broken bones, cut faces, cut bodies.
I don't hit with a bottle.
The frontal lobe part of the brain regulates your personality. If, say, you have a particularly aggressive personality, what the frontal lobe tends to do is damp down that aggression. But alcohol disinhibits the brain function, and that's one of the reasons that alcohol makes people aggressive. Friday night, Saturday night, from about 11 o'clock onwards, you will see stabbings, glassings, punchings, kickings, and it's all alcohol related.
Okay, Hans, 1, 2, 3.
Alcohol or drugs may be responsible for 19-year-old Junior's critical condition.
Open your eyes for me, please. Open your eyes, mate.
But the medical team's attentions are not appreciated.
Thanks, mate.
Did you get it, yeah?
And Dr. Dave's on the receiving end. Junior's friends brought him into A&E, but embarrassed or frightened, they left before anyone could ask them what he'd taken.
It's not obvious what the cause is. It could well be some sort of drugs, and we've given him something called Narcan, which is a reversal agent, to try and wake him up.
What's your name? What's your name?
And if we need to, we can get the intensive care doctors to come and see him.
Whatever Junior's taken is causing his temperature to drop. Specialised equipment is required to keep him warm. Meanwhile, a former patient makes a return.
Now I'm 30 years of age. I don't feel it. But if I knew I'd have ended up like this, just called out of him. No chance, mate. And look how bad it's gone since Saturday.
Ben's infection in his arm has got worse, and he's come back for treatment.
I mean, what are you worried about most now?
Dying. or losing a limb.
Junior's family, alerted by his friends, arrive at his bedside, but his condition shows no sign of improvement. An intensive care specialist comes to examine Junior.
Junior.
Junior. Oh yeah. I'm going to talk to Grace. Junior. Mum and Dad are here, honey.
Junior. Hello. Oh, he knows. He better not say so. Tell him.
I thought he said your son is dead. I said, what? He said, no, he's in hospital.
He thinks he's clever.
Keeping it away.
His family, who don't want him to be identified, discover from his friends that he's drunk far more than his body can handle. His parents don't allow him to touch alcohol.
So we're making a decision now whether he needs to have a scan of his brain to make sure there's the reason why he's not conscious level is because something's going on with the brain, but with the history of half a litre of alcohol consumed, I think we probably wouldn't do that now, or we may see how he progresses.
With time, Junior, embarrassed and hungover, recovers and is later taken home by his parents. Every year, the Royal Liverpool treats an estimated 28,000 people with alcohol-related problems. Some are severe. Michael, a recovering alcoholic, is troubled and comes for treatment. He sees Dr. Kate.
You ever sit down on here and tell me what's been happening? What's brought you into hospital? Have you been drinking? When was the last time you had anything to drink?
Before.
Today, you've had something today. And do you normally drink every day? How often would you drink?
Just binge.
You go on binges. Michael, tell me what's happening. What are you seeing?
Spiders.
Where are you seeing spiders?
Everywhere. You're my clothes.
Okay.
Or my flat.
At the moment, I think he's probably suffering from effects of alcohol withdrawal. And they typically have visual hallucinations, and it's usually little small things that they see, usually spiders or ants running around, which is what he's describing. They become very agitated and jittery, and they're at risk of having seizures associated with that as well. When people become alcohol dependent, they have problems with their liver, and the liver processes different toxins around your body, and what we find is that when people have any alcoholic liver disease, that when they go on binges they become very unwell. We need to do some tests to check your liver and everything, okay? You alright staying in this cubicle?
Dunno.
Doctors have now been able to contact Ben's GP and confirm the amount of methadone he's allowed. They can now give him his normal dose, and he comes into hospital without fear of withdrawal.
So no, you're very cynical, you've got
no,
right to be.
It's not that. I mean, you do. I wish that everyone who said it could come off it.
And this is my chance now to stop me injecting. Oh, this is the chance for me to get straight.
Yeah, and when it's better, it goes to the back of the mind, doesn't it?
To be truthful, it's scared the hell out of me.
Yeah, but it's going to get better.
I'm sick of it. I'm going to lose all my family as well.
Yeah.
Do you know what I mean? I've got to, just got to stop.
Dr. Hunter to resource, please. Dr. Hunter to resource.
It's proving a busy Saturday night in Liverpool. And two girls have brought in their friend who they think may have taken ecstasy.
Do you know what it is that she's taken?
Also, well, I thought you'd been spiked with published.
She said to me just before. She said
she took to me a tablet.
Right. What's this twitching about? You're sorry. What are you sorry for? Well, it's not a very clever thing to do, is it? Shouldn't take things, especially you don't know what they are. We don't actually know that it is definitely ecstasy. It's just a guess for the time being about what she may have taken. We'll probably never know, because she doesn't know herself. Pure ecstasy on its own is very dangerous, and you can die as a result of just taking one ecstasy tablet. It's a complete lottery about what you're taking. It's like putting your hand into a sweetie jar and one of them's a cyanide pill and the other's a Smarties sort of thing, and they all look the same and you don't know what they are. And you don't know until you take it that you're going to be somebody who's going to react to it.
I don't know, miss. You just want to react to whatever you took.
Michael's condition means that he's in danger of suffering a seizure. He's transferred to another part of the ward for close observation. Concerned, Dr. Rob checks on Michael's progress.
Okay. Have you got any palpitations in your chest? No. What about the spiders? Are they still there? Can you see them?
Yeah.
Where are they?
They're all over and you just can't see them.
All right. Some patients have tried to destroy the spiders or the ants with cigarettes and end up burning along their arms with cigarette burns because they're trying to get rid of the spiders, which aren't really there. It's a hallucination. How much did you drink when you were drinking?
This is whiskey yesterday.
Whiskey? What, a couple of bottles a day or a bottle a day? Or?
I just had a litre yesterday.
A litre?
And other stuff.
This chap, he's got what's called acute DTs, delirium tremens, which is a medical emergency. It needs urgent medical treatment. Without treatment, 15 to 30% of these patients would die. It'll take a few hours, but we'll get you sorted and feeling a lot better. All right.
Dr. Day's patient's condition has improved. She's anxious to leave.
I just want to go home now. I just want to go home and go to sleep.
I personally wouldn't have liked her to have gone home because I think she still needed to be in hospital and kept an eye on for 12 hours or so. The effects don't always show up straight away, and if she was to go home and have a fit, if she has it while she's in hospital here in the resus room, then we're able to stop the fit and do something about it. If she has it at home, she's got to rely on somebody calling an ambulance and getting her to hospital. But that's her right, is to sign herself out of hospital, no matter how ill-advised that was.
Michael is transferred to a more comfortable ward, where he stays for a few hours before leaving of his own accord.
Hi Ben, you alright? How's it going? Sit down. How's it doing?
It's a lot better since I was seeing you.
Oh yeah. You see the abscess has come up now, hasn't it?
It wasn't a clot, as they said. It's the on the ultrasound.
There's often a situation of trust with drug addicts, and if you lose that trust with them to a certain extent, they just leave and they don't want to have anything more to do with you. I suppose he must have realised that he did need treatment and that he had to come into hospital, and that was the best thing for him.
I'll come back, as you said, I would, because I had to.
Yeah, no, I'm glad you came back anyway.
I had to, didn't I? Otherwise,
You're doing well. Let's pop this back in here. Sorry. Probably best keeping it in here like this if you can. All right. It is. All right. Well done, mate. All right.
Thank you.
Take care. All right. Go on. Which ward you on? 3X. All right. Look after yourself. Take care.